There are really three main times when you might see someone from the anesthesia team on the labor and delivery floor. By far the most common is when a patient requests placement of an epidural for help getting comfortable during labor and childbirth. We're here 24 hours a day to perform that procedure, and we're usually here on the floor well within 20 minutes of your request of an epidural. Sometimes babies are born via cesarean section, and we also provide the anesthesia for that procedure. It works a little bit differently because it's technically a surgical procedure. So during those, we're there to make sure that you feel no pain during the procedure, and also that you're safe throughout and afterwards. The third time that you might see someone from anesthesia on the labor and delivery floor is in the very, very unlikely circumstance that a mother, or yourself, suffers a medical emergency during labor or childbirth. We're here at all hours to make sure that you're quickly recovered and back to the process that you came here for. Everything that we do here is at the request of the mother. Our job is to make sure that you are comfortable and also safe. There is nothing that we will force you into here. As most moms are well aware, the process of labor and childbirth can often be quite uncomfortable, even cause some serious pain, and there are many ways that we're able to intervene to deal with that. Different members of the team will provide different services in that direction. Your doula or your midwife might recommend certain maneuvers to help alleviate pain or find a more comfortable position. Your nurses and obstetricians will have options for medications that they might give you by mouth through an IV in order to minimize pain. But when patients request stronger methods of pain control, like an epidural, we're here to provide those services for them so long as they're safe. The things that could make it unsafe to place an epidural, those are usually issues with your blood being too thin, like you're taking a blood thinning medication or you have a condition that stops your blood from clotting effectively. Other reasons that it would be considered unsafe to place an epidural would be having an infection over the skin of your lower back. If your blood pressure is particularly low, sometimes having an epidural can push it down a little further, and if we think that it would put you in an unsafe blood pressure range, then we also would not perform the procedure. An epidural is placed in your lower back. So if you have a condition called scoliosis that changes the anatomy of your lower spine, it can sometimes be difficult to place an epidural, or it may only cover one side of the abdomen or the other. This is similarly true if you've had major surgery on your lower back. We can certainly attempt to place an epidural, but sometimes the medicine might not reach all of the places it needs to reach to make you completely comfortable. On the early end of things, one question might be, well, an epidural can last for as long as you want it to last for. Why not just get it when you walk in the door? That's a great question, and the reasons are that for safety's sake, once you have an epidural, there are two major limitations in what you can do. Once you have it, your legs can be a little weak and shaky, so you have to stay in the bed where you are. And the other is that for safety reasons, once you have your epidural in, you're limited to a diet of clear liquids. Are also able to just go to sleep for surgery or any type of procedure that you might need. For example, if you came into the hospital and you weren't pregnant and needed your appendix out, that's exactly what we would do for your surgery. But when someone's meeting their baby for the first time, it's not usually desirable to be out of it or groggy, and so we typically try and avoid that and do things a way that's more conducive to having a great experience of childbirth and also safer in many instances. People have many, many questions that I'm sure that I haven't touched on here. There is someone from our team here 24 hours a day, 7 days a week. You are welcome to ask for us to come down and answer your questions anytime that you're here, or to call in and someone will connect you to a member of the anesthesia team who can answer your questions about anesthesia during labor and delivery.